Hi everyone, my name is Sandesh. I'm the pharmacist over here in Australia. Today I'm going to talk about one of the topic, and it is related to the book known as AMH or Australian Medicine Handbook. Okay, it is the common book that all the pharmacist or the healthcare worker need to know about, and all the content of many of the content on this book need to be known or should be familiar with those things. Okay, this video is mainly dedicated to all the intern pharmacist or the pharmacy student who is currently pursuing their degree in the university or the colleges, or the overseas pharmacist who is on the way to become a registered pharmacist here in Australia. Okay, hopefully this video find them more helpful, and today I'm going to talk about this one. Okay, with this book, the main common factor with this book is the flagging issues. Many people have the issue with the flag, like where to flag or how to flag, and where to see the content, how to read this book. So I'm bringing this content to make them easy to know, to be familiar with this book. Okay, this is the book of 2024. They have already got 2025, I think. And I bought this book because in 2000 I did my internship in the year of 2024, so I do have this book. Okay, if someone has the different, the content should be most likely the same, and there might be few changes. Okay, so if you already have the 2023-24, don't be panic, just stay with that one. You don't need to buy 2025, but it depends up to you. If you like, then you can go for that one. Okay, and the main thing is with this one, there are different chapter up to 20 which contain vaccination, and starting from the allergy and anaphylaxis to the vaccination, it has all the chapter. It has all the thing that is needed for a healthcare professional. Even the doctor follows this book, either in the like soft copy version in the computer, or like a physical book. Okay, many of the, not many, all the doctor need to follow this one because this is the guidelines, and it is a guidelines treatment. It is like a treatment guidelines for all the people here in the Australia. Okay, and with this one I'll show you how to highlight the main topic of this book and how to highlight the all the core part of this book. Okay, at first make sure, how do you like to highlight, it's a depend up to you. I'm just showing my way. Different people might have the different way. Okay, this is the way I like the most, and that was the favorable for me during my exam. Okay, so with this one, at first, see over here, it was allergy and anaphylaxis. All the content is showing at the back, so I had highlighted like this. At first is allergy, and second was the anesthetics, and I have highlighted two as an anesthetic. I was highlighting like on the main portion of the main chapter with all the units and the chapter are shown like this. Okay, I have highlighted over here. And going back to other thing, for example, the last, let me show the next one, the gastro, all the gastrointestinal drug I have highlighted on this page. Okay, for example, I need to find anything. For example, there was a case and I need to find about one particular drug. Let me check. If I need to find about the doxycycline, any antibiotic doxycycline, or any penicillin, cephalosporin, anything, I'll just directly go to the antibiotics and antiviral because it falls under the antibiotic section. So I'll just put my finger over here and flip this one like this, and I can see all the anti-infectives. Okay, over here I was looking for the amoxicillin, page number 124, so I can easily flip this one as a 124, and here I go, all the drug of the penicillin that include the amoxicillin. Okay, that was my way to look. And for example, there was a common case in my exam, and for example, if you forget, second thing, if you forget about anything particular drug and you can't find over here, don't waste your time, just highlight this section as A, B, C, D, E, F alphabetically. Okay, if you do so, then for example, if you are looking for cephalosporin and if you can't find over here, you can directly move over here, C on C, and just go like this and just check over here. Okay, cephalosporin CE. Over here it is a cephalexin 109, and I can directly go to page number 109. Just a sec. Here you go. This is the way to look. This was my way. And second thing, while highlighting the inner thing, at first I'll say you can go with the all the drug at first, go thoroughly, and like I know it is hard to remember all the drug, but mainly highlight all the important thing. For example, I can show you with the antibiotic. I know there was a case, you need to go through, you need to have the rough idea of what is that and what might be the precaution, everything. But even though if you forget, there is a book with you in your exam, it might be helpful. Okay, for example, with the cephalosporin 107, if I go on 107, with the page number 107, I have highlighted, see, I have highlighted the main thing. Okay, what is the main thing? How do you know? Because I have given my exam, so before that also I have gone through all the resources, so I know what were the main thing and what is the common thing. So with the precaution over here in the allergy section, there is contraindicated with the history of allergy to cephalosporin or the uh, immediate or the severe hypersensitivity to the penicillin. That means be careful if there is a carbapenem or penicillin allergy. Is cross reactivity between the penicillin, cephalosporin and carbapenems can occur. That means if someone is having the someone come in the pharmacy with the amoxicillin or any penicillin drug, and oh sorry, any cephalosporin drug, and they say they have the allergy with the penicillin, make sure they don't have any anaphylactic reaction or any severe reaction, because is according to the AMH, it says that if someone has any allergic reaction with the with the penicillin, they might have the allergic reaction with the cephalosporin too. So it might be hard for them. So make sure they don't have those issues. If they have those issues and they haven't had that medication before, like if they have allergic with the anaphylactic reaction with the amoxicillin and they are coming for the cephalosporin, any cephalosporin drug, and they say they haven't had this drug before, then make sure you contact the doctor and let them know about that one. Okay, many of the doctor will be aware of that, but in case some of them are not aware of that, just make sure. Okay, this is the way I used to read. In adverse effect, which are the common thing, and in about the doses, everything I used to highlight like this. Any precaution where you can't give that one. Okay, and any important thing I just write on the top. That was the way I used to, like for example, uh, let me go with one of these. There was the common thing on. Okay, for example, with the clindamycin, there was the case with the bacterial vaginosis. Okay, the dose was different. I think the dose was 100 milligram once daily for 10 days. I got a script of that one, and in my like a practice exam, and but the dose of the clindamycin for this condition, bacterial vaginosis, should be oral 300 milligram twice a day for 7 days. You need to know that one, otherwise you need to know where to find that one. Okay, smartly, just study smartly rather than uh, try to remember each and everything. Just read smartly. Okay, and for all the guys, best of luck for your exam. I know you will be a good pharmacist in the future. And lastly, there are some of the table over here. Don't forget about this one. There are the age and weight and height, everything is on this one, and some of the like common laboratory values, everything over here. And what else? Oh, there might be something. Oh, interaction, don't forget about the interaction. With the most common interaction, I used to highlight like this. Okay, just don't forget to highlight You need to highlight everything. The important interactions, just highlight that one. Okay, all the interaction are on this section. Okay, all the interaction, and it will be shown if there is some interaction. It will be shown, for example, if there is interaction, it will show that look on this page. For further information, look on this page. For example, there is paroxetine over here. For drug interaction, see SSRI page number 1094, paroxetine page number 1095. It will be showing all the information where to look. Okay, and yeah, everything is like that. And the common chapter, the second common chapter on this one is, don't forget about drug of choice. Don't forget about the drug of choice. Okay, antibiotic drug of choice. Just drug of choice, I have highlighted that one is like this. There is the table in which condition which drug must be used, and like what might be the first choice, alternative, like this. Okay, all the information, make sure you highlight this page too. Okay, and going back, the important other thing is, oh, serotonin toxicity. Okay, that is the chapter. This is under the depression chapter. Okay, there is a box, antidepressant changeover guides. This is also so much important. Like if someone is changing from one antidepressant to the another one, how many days they need to wait for, what is the washout period, everything is over here. Okay, you need to highlight this page. Okay, I have done like this, antidepressant changeover guide, like this. Okay, and there is one, I think there is one, lithium toxicity. Okay, don't forget about that one, lithium toxicity. Don't forget about the common thing, serotonin toxicity. Okay, the drug that may contribute to the serotonin toxicity. Don't forget about this. This is so much important thing. Okay, and epilepsy, migraine, seizure drug. There is a drug for the seizures. Okay, um, seizure drugs with the anticholinergic effect increase the risk of seizure. Whenever there is the question in the exam, remember this table, highlight this table. Okay, don't forget to highlight that one. You need to, ACS side effect, everything, asthma, epilepsy, QT interval, and other thing. Yeah, QT interval, it is also one of the best table. Okay, you need to highlight this table too, remember that one. And oh, lastly, I think this might be the last thing, opioid comparison. Okay, don't forget about this one, because in the exam you might get, it might be coming on the written exam as well as on the oral exam. Okay, remember about this one. There is the guidelines to change, like fentanyl, this amount is equivalent to the morphine of this amount. You need to know about this one. You can find this on the other book too, with that one. That is on this book, APF. I do have the 26, I think they already have the 27. That is also on this book. Okay, one day I'll make the video of this one, and you can follow my channel for all the information. This is how I used to flag my book. And lastly, the vaccine, don't forget about the vaccines too. There are a few of the questions related to the vaccines. You need to go through that one too. Okay, and change over, this is pretty much many things that is covered today. Okay, hope you guys like my video. Best of luck for everyone for your exam and upcoming future. I know you will be a best pharmacist over here, and thank you so much. Subscribe my channel and wait for next other video. One day I will be making the video on the APF 26, otherwise APF, Australian Pharmaceutical Formulary and Handbook. Okay, thank you so much.